Hello everyone, this is a quick video about laparoscopic intracorporeal suturing. My name is Ayman, the endometriosis fellow at Croydon University Hospital. Suturing is an essential skill in laparoscopic surgery. At the beginning I found the technique is very challenging, hence I'm doing this video to share with you what I learned about the theory and some tips that might help you in your learning curve. First, I will start with my common mistakes. Sometimes I did this error by performing a surgical knot like that, and eventually I ended up with an extra loop inside my knot. At the end of this video, you'll be able to spot at least 6 mistakes in this technique. This is another example from my common mistakes, and as you can see, I managed to create more or less a nice loop. However, I'm using the incorrect hand to perform the surgical suture, and at the end you can completely lose your hand coordination. Well, what I prefer to do is to split the technique into 4 simple steps in order to be able to practice and in order to know which part is your weak part. The most important first step is to know how to create a loop. If you are right-handed, so your first loop will be the C-shaped loop, and you will need to hold this loop with your right hand. If you are left-handed or if you are using the backward stitching, your first loop should be a D-shaped loop, as you can see, and you will need to hold this loop with your left hand. And please note that we always hold the loop with the ipsilateral instrument to the short arm of the thread. The loop will not be sturdy if you are using extra length, like you can see here, and you will struggle with your surgical knot, and this will occur with all kind of threads, especially with threads with high memory. This is another example of an extra loop on the D side. So try to make your C and D loops approximately triple the length of the short arm of your thread. So now is the main step, the double through. How to do the surgical double through. So first, perform your C loop and hold it with your right hand. Make sure that it's triple the length of the short arm. A useful tip here is to align the hump of your loop to keep it sturdy. Then you will need to twist the loop upward with your right hand before starting the double throw with your left hand. Same steps again. Create your C loop, align the hump with your leading instrument, twist your right hand upward before starting your double throw. You can see now the same steps but with the D-shaped loop. Align the hump of the loop, start your double throw. I usually prefer, when I use a needle holder to do the double throw, is to keep the jaw of the needle holder opened, as the jaws of most needle holders have shallow curves, not like the Maryland kind of curve. Please note here that I make 2.5 throws in order to bring my leading instrument to the front. After you perform your surgical double throw, you will need to pick up the short arm. It is crucial in this step to move both your instruments hand to hand together, as you can see here, and pick the short arm from the tip point. And please remember, don't pick the base of the short arm. As you can see here, it will make your life more difficult. Next, you will see what will happen when you move only one instrument to pick up the short arm as you do in open surgery, and but unfortunately it doesn't work in the same way. As you see, we do the double throws and half to bring the leading instrument forward and move both instruments together, and then pick the short arm from its tip. The last step is to complete your surgical knot tying by pulling the short arm of the thread through your loop. As you can see, again the same technique, moving both instruments together, then pick the tip of the short arm. And now remember that the direction of your pulling force is not perpendicular to the suture line as in open surgery. However, the direction of your pulling force has to be aligned with your leading instrument, which is the instrument that holds the double throw. We all have this habit when we position our surgical knot is to direct our force perpendicular to the suture line. Unfortunately, this doesn't work in laparoscopy. The pulling force, as your loop will get stuck in the groove of the instrument. I used to blame my Maryland or my needle holder for that until I realized that it's all about your technique and the direction of your forces, not about the quality of your instruments. And the same apply from the other side, from the C loop side. And please note, we align the direction of force in the same way with the leading instrument. Would much appreciate your comments, your tips and tricks about intracorporeal laparoscopic knot tying, and thank you very much for watching.